Today's video topic is hair transplants. A hair transplant is a type of surgery that moves hair from one part of the body to bald or thinning areas. The surgery can be done with local anesthesia and usually takes 4 to 8 hours. Hair transplants are usually done to treat male pattern baldness, but they can also be used to restore eyelashes, eyebrows, beard hair, and to fill in scars caused by accidents or surgery. Types of hair transplants. There are two main types of hair transplants: follicular unit transplantation, FUT, and follicular unit extraction, FUE. FUT is the traditional method of hair transplantation. In this method, a strip of skin is removed from the back of the head. The hair follicles are then transplanted to the balding area. FUE is a newer method of hair transplantation. In this method, individual hair follicles are removed from the back of the head and transplanted to the balding area. Effectiveness. Hair transplants are a long-term effective solution to hair loss, but the results will vary widely depending on the skill of the surgeon and technique used. The transplanted hair will usually fall out within 2 to 3 weeks, and the new hair will begin to grow within 2 to 3 months. So in most cases, the patient will end up with thicker-looking hair after the surgery. But the old existing hair may still continue to thin, which can make a thin, patchy look after a while. In these cases, 2 to 3 hair transplant procedures are needed to achieve desired results. Also, hair transplants work when the patient has healthy donor hair in other areas. So it won't work for hair loss from general widespread balding or for hair loss from chemotherapy. Side effects. The most common side effect in hair transplants is swelling of the scalp. This usually goes away within a few days. Other possible side effects include infection, bleeding, bruising, and scarring. The patient may also have numbness, itching, pain, and temporary hair loss in the first few months. In some cases, the transplanted hairs will fall out and die with no new hairs. So, it is very important to do the checkups to make sure that you're an ideal candidate for the procedure. Recovery. Most people recover from hair transplants without any problems. The transplanted hair will begin to grow within 2 to 3 months. You will need to take care of your transplanted hair. This includes shampooing and conditioning your hair, avoiding harsh chemicals, wearing a hat or scarf when outdoors. Also, you should avoid strenuous activity for at least 2 weeks after the surgery. You will also need to see your doctor for follow-up appointments. These appointments will help your doctor check your progress and make sure you are healing properly.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.